The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters at the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, and, of course, a socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Atal Qureshi. Did I catch that right, Doctor?
Yes, sir.
Okay. Cardiologist at Altman Dubel Health and Vascular Hospital. Good morning, Doctor, and welcome to the show.
Thank you.
Heart failure is a scary term. It sounds like the heart isn't working at all, but it actually means that the heart isn't pumping as well as it should. It's a serious problem, but it doesn't mean that it can't be managed. With the help and proper management, people with heart failure can still live a full, enjoyable life. This morning, we're going to talk with Dr. Qureshi about heart failure and other common cardiovascular conditions. We'd like to remind our listeners that this program is available on our podcast. You can download that from the App Store on your mobile phone. Just search for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Doctor, we've got a couple of announcements here this morning. It is an exciting time in the pharmacy as we celebrate our 45th anniversary by giving away $45 gift certificates to anyone who stops in to register. I would like to take a moment and announce the winners of this week's 45th anniversary drawings. At the Canton location, Sue Gallagher from Canton is the winner of a $45 gift certificate to Anastasiades Chocolates. That's a lot of chocolate. At our Minerva location, Krista Archer from East Rochester is the winner of a $45 gift card from Kishman's IGA. And at our Louisville location, Emma Lou Wagner is the winner of a $45 gift certificate to Anastasiades Chocolates. So stop by and register so you have a chance of winning next week. We are giving away gift certificates to Lindsay's Restaurants, Anastasiades Chocolates, Grinders and Above, Beyond, and Kishman's IGA. So, Dr. Qureshi, welcome to the show.
Thank you.
Thank you for your service to the community during this pandemic. You and our healthcare workers are appreciated. So tell us a little bit about yourself. Introduce yourself to our listeners.
So I'm originally from Pakistan, did my residency at a hospital in Chicago called the Cook County Hospital. Then went over to Pennsylvania, did my cardiology fellowship at a hospital called Lehigh Valley Hospital in Allentown. And then did a heart failure fellowship for a year up in New York, Westchester Medical Center, which is in Valhalla. Then went back to Pennsylvania, spent some time in a health system called Geisinger, and then went over to Philadelphia for a hospital called Jefferson University Hospital, and spent some time there taking care of heart failure prior to coming over here.
So, I'm glad you're here. What attracted you to Stark County?
So, one of my friends, he told me about the opportunity that is present here in the community and the heart failure void that was here that potentially could benefit from heart failure services. So then I explored this option and, it was attracted. I was attracted to it and I thought it'd be a good idea to move over. So.
And you have a family?
Yes, I do have a wife and two children, 8 and 10-year-old.
How do they like it here?
They like it. I mean, I think the school districts are good. I mean, everything is pretty good. I mean, you don't have the commute back in Philly, so life is a little bit easier from that standpoint.
So, what common conditions do you treat at all?
So we treat almost a full spectrum here at Altman related to cardiovascular disease, including coronary artery disease, blockages, and then rhythm disturbances, as well as now with in my presence, we are treating more and more heart failure as well. So we do different procedures here, some valve procedures like TAVR, where we place a aortic valve percutaneously. through the groin, we go in and access and replace the valve. We also work on valves, the mitral valve, and a procedure called MitraClip, and do all kinds of ablations for the atrial fibrillation and other common rhythm disturbances. And we have a complete cath lab. We do stents and treat heart attacks. We have a high volume of heart attack that we take care of with providers that are trained specially to take care of that. So I would say we have a full breadth here that we're taking care of from a community standpoint.
You know, you mentioned it when we were talking before the show that that there were a lot of people that you think are didn't actually have a heart attack while they were at home and avoiding treatment. And I have a relative who recently had triple bypass, and the cardiologist said, I think she had a heart attack before. And I guess, what's the survival rate of these? I mean, just a minor heart attack, or it have to be only minor, right?
Yeah, I think that depends on the intensity or the severity of the heart attack. If the heart attack is minor, meaning that a small portion of the heart muscle was affected, and it was most importantly, intervened upon in a timely fashion. When it comes to the heart, time is muscle. So the sooner somebody can get into the ER or to the hospital system and ask for help, the sooner we can save the muscle. So a heart attack that was supposed to be minor could turn into a major ordeal if there was delay in care. So I think that, as you said, the outcome would depend on whether it was minor or major, and it'll be a spectrum.
Do we call all heart failures a heart attack, or is that just too generic a term?
Yeah, so I think if you look at the heart, I would look at it divided into various faculties. So the heart is a muscle, like our biceps. I mean, it's a different muscle, but it is a muscle. So that's one component of it. Then there's a blood supply to the muscle. Then there's the electrical supply to the muscle. And then there are valves, doors within the heart. And the heart sits in a membrane called the pericardium. So when you divide cardiovascular disease, you should think about it in those boxes. So when it comes to a heart attack, what is a heart attack? Heart attack is something that specifically affects the arteries, that blood supply that we talked about. And when the blood supply is blocked, it will cause, the heart muscle to suffer. And our heart muscle needs oxygen. And after a few minutes of oxygen deprivation, your heart muscle will start dying. And then if not intervened upon and the artery is not opened up, it may ultimately turn into scar tissue. So when it comes to heart failure and a heart attack, how do we differentiate the two? Heart is a specific term that deals with the blockages in the arteries of the heart, leading to heart muscle damage. That can lead to heart failure. Heart failure is a situation where the heart becomes ineffective or inefficient in pumping the blood. The job that it is supposed to do is to pump blood. And when it becomes inefficient in that, you call that situation heart failure. And, heart attacks can lead to heart failures because if you block the artery, your muscle suffers and the muscle can't pump. And now you're in a situation where you're a heart failure situation where you can effectively move the blood forward. So in this particular example, the heart attack led to heart failure, but there's so many other reasons why the heart muscle can become ineffective or inefficient and leading to heart failure. So heart attack is ways to get there.
So what about the common conditions that lead to heart disease and heart failure, actually?
Yeah. So I think one of the things that predispose to heart disease, the most common one in the country is the blockages or coronary artery disease related to plaque buildup, and we call it the atherosclerotic disease affecting the arteries. There's blockages that develop over a period of years. Hypertension is another one, high blood pressure, and then the obesity pretty much linked to some of the development of these things that lead to heart disease, and diabetes is strongly linked with it. all of the things that come to our mind, obesity, diabetes, hypertension, they are directly linked with heart disease. Smoking is a big one. And all of them in combination can lead to blockage development. And that kind of really, if you develop a heart attack and now you're in a situation that you have heart disease and heart failure and so on, possibly heart failure. Not every time you'll develop heart failure if you develop a blockage, but you're more at risk. And it's one of the most common risk factors for development of heart failure is a blockage, is a coronary artery disease.
Interesting. The smoking thing just still gets me. Why people are still smoking? I just can't figure it out. I talked to somebody the other day. She said I finally quit smoking. She said I did the gum thing. She said it took me a long time, and I was really miserable trying to get off of cigarettes. But after 20 years, but they did it, and it's just I've never been involved in a situation like that where I smoked very much or couldn't get away from it. So
yeah.
It's hard to imagine. It really is.
So, Doctor, you mentioned some conditions and some surrounding factors that put people at risk. Is there anything else you want to say about the type of patient that's typically at risk for heart failure, or should we move into preventative measures?
Yeah, I think that pretty much is what I wanted to say. I think we need to, one thing that common public may not know is stages of heart failure, and that's something that we don't talk about too much. But I think we should think about it also in terms of stages A through D, where stage A is where we are all at people who are at risk of heart failure. They haven't really manifested clinically, but the way the risk factors are surrounding them, like smoking, obesity, diabetes, hypertension, uncontrolled conditions like that, they will put them at a stage A. So we are kind of all, like if you go out to a fast food restaurant on a regular basis and we have our lifestyle set accordingly, we are already at stage A of heart failure. B is where you have developed issues with the heart muscle, but you don't know it yet because you haven't developed those florid symptoms. So you haven't sought attention yet from a healthcare provider. Stage C is where now you have the muscle damage or whatever else damage to the heart and you have symptoms. And D is like end stage. So many of us will be walking around in stage A. And I think that's kind of one way to think about our lifestyle and things we're doing.
Very interesting.
Why don't we take a break here, Doctor? You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. Everyone has been tuned in to where to get their COVID vaccine. We've been proud to serve the community in this process. The Medicine Center offers many other vaccines like shingles, influenza, pneumonia, Tdap, meningitis, MMR, hepatitis A and B, and travel vaccines. Do you need a vaccine? Give us a call at the pharmacy or visit our website at medshoprx.com to schedule your appointment. Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters at the Medicine Center Pharmacy. It is our 45th anniversary, and we'd like to invite you to transfer your prescription to the Medicine Center Pharmacy to receive a $25 gift certificate to our pharmacy. It's simple. Just call and talk with our pharmacist.
Okay, doctor, before the break, you were talking about risk factors for heart failure and what those look like. How about we talk about the positive side? Let's talk about prevention. What can we do on a daily basis to hopefully get to see you on this podcast and not have to worry about having something like heart disease happen to us?
Yeah. No, I think that pretty much, what we can do is to minimize the risk factors. And, as guidelines would recommend, regular exercise up to 5 times a week, increasing portions of fruits and vegetables in the diet, and pretty much trying to minimize processed meat and meat products, considering dietary changes like considering Mediterranean diet that has been shown to improve cardiovascular outcomes, increasing, for example, fish and lean meat, and minimizing red meat, avoiding high fat content and high sugar content. So those are the few things that we can consider at an early age, especially when we are younger, and incorporate that in our lifestyles as we grow older, to create a positive impact in our lives and the overall healthcare in the country.
Doctor, I'm sure you see it a lot in your practice and when you're meeting with patients. In the pharmacy, we see an awful lot of patients who you can give details like you just did on common sense foods to eat and habits. But sometimes it seems people just never really learned how to eat or to cook for themselves. And sometimes they default to those quicker foods that are really high in fat and have consequences down the road, as you mentioned. So I think we could all take some time to learn how to be a better consumer for our diet. But, why don't we talk about some signs of heart failure? Are there things that we can see as a patient, warning signs, before we would get evaluated by you?
Yeah, so some of the things that are common signs and symptoms of heart failure. So as a patient, you may feel that your legs are swelling up as a common symptom, or that you are getting more short of breath with activities. Shortness of breath could be related to multiple different, you can imagine, but heart failure is one of them as a possible cause. And then waking up short of breath at night. That's a common one and an important one to pay attention to. So if you try to sleep on a regular bed and you are unable to sleep through the night and you have to sit up to catch your breath, that should get prompt attention because that could be a heart failure symptom. And it could be associated with some other symptoms. If there are rhythm problems or blockages that are going on, you may develop chest pain or tightness along with the symptoms of shortness of breath, and may sometimes develop dizziness if there are rhythm problems along with it. So, these are the few symptoms that we can watch out for.
Are the signs the same for men and women?
Women may have slightly different symptoms when it comes to coronary artery disease. Sometimes the chest pain may not be as prominent or may go unnoticed, or maybe more like a shortness of breath-like symptom rather than a frank kind of elephant sitting on the chest symptom. So that may be some differences when it comes to coronary artery disease that can obviously lead to heart failure. Women and men, when the heart failure is a disease that happens mostly as we grow older, there's increased prevalence. So when it comes to that kind of age group, 65 or above, you may find similar incidences in both men and women when it comes to heart failure specifically. So
you give me the impression that it may be easier to overlook symptoms in women. Is that right?
It might be possible that, that it is truly something that needs to be, looked at immediately, or it may not be something that is classic for us, like, the chest pain and the patient may not seek attention, thinking something else. So, I think that the bottom line is if you're concerned about it's a new symptom, it's best to kind of test it and checked out.
Okay. If someone has experienced symptoms, what should they look for?
What do you mean? What should they look for? Like in their body, like what do they feel, or what?
Yeah, I mean,
their body.
I've heard all kinds of people tell me all kinds of symptoms, and and then afterwards we heard they had a heart attack. So, like chest pain right down the sternum, and chest pain on the left side, down the arm, that sort of thing.
The most important thing is a couple of things. One of them, heart is a muscle that is designed to pump blood. And as you exercise, it has to work harder and pump more blood. Any cardiac symptom typically would get worse with exertion. So if you're developing symptoms that are exertional, meaning you have this discomfort, whether it's the left side or the center or wherever else, but it gets worse or develops every time you exert yourself, that's a serious red flag. You got to seek attention there. And typical symptom, though, is a retrosternal, like central chest pain that radiates either to the arm or to the jaw. It can go to either arm, left or right, or sometimes to the back as well. But that's your classic symptom and feels like a vague pressure-like or heavy tightness symptom. Typically, if you can pinpoint your pain with one finger, like it's right here, that may not be the heart. It may be something, else as well. But, I think that if in doubt, get checked out is pretty much what I would say, because as I said before, time is muscle when it comes to the heart.
Wow. Okay. It's the bottom of the hour and time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out By Store in Louisville, next to the Medicine Center Pharmacy.
Fall already? That's crazy. It's time for our Fall Festival of Art at Studio Arts and Glass. This Friday and Saturday, September 10th and 11th, from 10 to 6. Featuring handmade pottery, unique jewelry, and of course, stained glass. Join Studio Arts and Glass for food, refreshments, and fun. Find us on Apple Grove and 77 in North Canton or online at studioartsandglass.com.
Poison ivy can be a real pain and very hard to deal with. Hi, Paul White from the Medicine Center Pharmacy. Let me recommend a product that I have personally used. Poison ivy pills. This homeopathic remedy prevents and treats the effects of poison ivy, oak, and sumac. It's completely safe for adults and children, and there aren't any side effects, so ditch the itch and get relief with poison ivy pills at the Medicine Center Pharmacies in Canton, Louisville, and Minerva, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. We are talking with Dr. Qureshi from Altman Heart and Vascular Hospital. We have a lot more to cover this morning, so let's get back to the show. Smoking. Let's talk about smoking. We kicked it around already a little bit. And why is it bad? And COP, cause of COPD, does it lead to heart failure?
Yeah, so smoking is one of those things that, it has a linear relationship. Like the more you smoke, the worse it will be. But even if you smoke a little bit, it will still be pretty bad as compared to if you were not smoking at all. So it has been directly linked to coronary artery disease and blockage development and heart failure as a result of that, and COPD, as you said, cancers of various sorts, and strokes. So, smoking is something that obviously is one of our biggest risk factors, even whether you first-hand or second-hand smoke. So this is one of the first things we tell our patients is to stop smoking. It's one of the most difficult ones to accomplish.
What about the secondhand smoke issue? Okay, even a mild amount.
Yeah, I think as it comes to the complex compounds that are inhaled with cigarette smoke, even a small amount has been shown to cause issues. And secondhand smoke, would be similar. It's shown to have thousands of extra deaths per year from heart disease as well as lung cancer. And I think that any exposure would be something that you would like to avoid to prevent complications like heart disease and other diseases that can cause.
I had a father who grew up in the steel industry, and of course he died in his early 50s from lung cancer and mouth cancer and all that kind of stuff. And I can remember as a kid in this area, this was a huge steel area at one time, and probably still fairly high in manufacturing of steel and metals and stuff like that. But I can remember looking at the sky years ago, and some areas of the city, the sky was blue. I think most of that's been cleaned up, for the most part. But it just still seems like once in a while you'll go by a mill or something like that, and you'll see them spewing out all kinds of whatever, and they supposedly have taken care of eliminating as much of the whatever coming out of that mill. In fact, just was a little while ago there was something about the lead that was being put out by one of the local mills, and I don't know what that's about and how that is, and if it can be fixed. If you're going to continue to make steel. So what's up? I don't know. I don't know how to solve that cigarette problem. I mean, in the 50s, I was watching TV, and they had substitute doctors in white coats saying, "Well, I recommend to my patients Kent with a micronite filter." I mean, this is really these commercials. Once in a while, you'll see them played on a program that shows how this cigarette thing really got going in America. and around the world. So we just don't seem to be able to stop this.
Yeah, no, I think that many patients, interestingly, when they develop a heart attack or they had bypass surgery, they stop smoking after that. That was a major event in their life. So I hope that people who are listening can stop it before they get towards some kind of a major event like that.
I've seen pictures of lungs that have been cut open with people smoked all their life and they're black.
Yeah.
I'm thinking, my gosh, how did you breathe another second before you died, Anyway.
Yeah, there are people walking around with supplemental oxygen because of COPD and still...
Yeah, all the portable units, sure. Amazing. So how many doctors are in your practice at the hospital, Doctor?
So roughly around 20 cardiologists. We have there and some nurse practitioners as well in addition to them.
What smokes?
What are some of the latest developments in heart failure diagnosis and treatment?
So I think if you look at heart failure, the development of something called echocardiogram, an ultrasound that has been there for years and decades now, has been extremely important in cardiology in general to look at the heart more carefully. And I think fast forward over a period of time, things in diagnosis include technology like cardiac MRIs and some other very specialized tests like PET scans in select group of patients. We're looking at very specific diseases that can cause heart failure like sarcoidosis. So I think over a period of years and decades, the imaging part of cardiology has really blossomed to a point where we can diagnose heart failure, the different components of it, quite well. So that's one thing I would say from a diagnosis standpoint is the imaging. And then obviously technology that are developed in cardiology in general, like catheterization and other things along those lines have been crucial in diagnosis and helping with diagnosis of heart failure. You said diagnosis and treatment? Sorry.
What does an echocardiogram tell you?
An echocardiogram pretty much is an ultrasound that gives us a picture of the heart beating real time. It gives us an idea of the valves of the heart, those doors inside the heart. What are they doing? Are they leaking, or they're functioning normally? And what is the membrane that surrounds the heart also doing? And if that's playing any role in development of heart failure. So pretty much gives us a complete insight into the size and function of the heart, the valves, and the membrane that surrounds it, and gives us an insight as to why the heart failure might have developed. It also tells us about the thickness of the heart muscle. If the heart is normal thick, is it thin, normal size, or is it thick heart? And that can also be related to multiple heart failure reasons that people can develop heart failure if they develop a thick heart muscle.
Well, is an echocardiogram a sort of a CAT scan, or it's a non-invasive test?
Yeah. It's an ultrasound. So you put gel on the chest and take and pretty much it gives us a picture by sending ultrasound waves. And it is not something that is invasive, as you said, and it's a straightforward, simple procedure. In fact, I have a portable machine. I can do an ultrasound echo in my office while I'm seeing it.
Oh my gosh, no kidding. I remember having one years ago, and it was fairly simple. I expected you'd have to run the treadmills and all that other kind of stuff, but it was a fairly simple test. So,
which developments do you feel have had the most impact on you and your patients, Doctor?
I think that developments that have really helped us the most, from my personal experience, are some of the developments from a therapeutic standpoint, medications and things along those lines. You got to keep in mind that majority of heart failure, 95% of it, is something that may not be advanced, meaning that you can either stabilize it or improve it with medications. And one of the medications, the sacubitril valsartan, has been one of the crucial, also called as Entresto, has been crucial in improving some of the patients that have weak heart muscles with heart failure. And obviously, we use technology like MRIs when we don't have an obvious reason for heart failure to further evaluate and diagnose them. So I think if I would pick two things, I would say, and most recently Entresto, and imaging modalities have helped me particularly. But obviously there are other drugs out there, beta blockers and spironolactone, and so many others that have been around for a while that are crucial in our ability to treat them. And recently, some of the other drugs that were initially thought to be diabetic drugs, like SGLT2 inhibitors, are coming out as drugs that may be able to improve outcomes in patients with heart failure, like make them live longer and make them feel better.
Very good. So, what is advanced heart failure, and how is it treated in 2021?
So advanced heart failure is a subgroup of heart failure where we, as we said initially, there are 4 stages, A, B, C, and D. So if you're falling in kind of stage D, where the heart has whatever mechanism damaged it, either blockage or some other reason, like a viral infection, sometimes there's certain viruses like Coxsackie and some other ones that are used to cause cardiomyopathy or weakness of heart muscle or heart failure. If whatever the reason was, once it comes to a point where we cannot really make you feel better with medications alone, or we are not able to improve your symptoms, and the symptoms are pretty severe, then at that point we think about consideration of things like heart transplant or a heart pump called an LVAD that can pump blood for your heart when the heart muscle becomes weaker. And in 2021, the example I would give is like our smartphones. You know, our smartphones used to be a brick phone back in the day, and now they're all smart. The LVAD, the heart pumps have evolved to a point of becoming smaller and sleeker. And, it is possible that over the period of years, they may improve to a point that it will become even smaller and, they will lose some of the problems that they have to become more smarter and better and may overcome a heart transplant as a possible leader, or the mainstay of treatment. But currently, I think that's what I would say is the technology is evolving, and we are able to support sicker patients now with temporary and permanent pumps. And, that has really been an improvement as compared to, let's say, 20 years ago. And obviously, heart transplant has been there for a while, and it still stays as an excellent treatment choice for these patients.
Wow, interesting. Okay, our final break this year. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center Pharmacies, we give you, at no charge, a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand-name test strips. So stop in any Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Poison ivy can be a real pain and very hard to deal with. Hi, Paul White from the Medicine Center Pharmacy. Let me recommend a product that I have personally used. Poison ivy pills. This homeopathic remedy prevents and treats the effects of poison ivy, oak, and sumac. It's completely safe for adults and children, and there aren't any side effects, so ditch the itch and get relief with poison ivy pills at the Medicine Center pharmacies in Canton, Louisville, and Minerva, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters, the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show.
Doctor, what other areas hold your interest in medicine?
So one of the things that I was back in doing my heart fellowship is a disease called pulmonary hypertension. This is a disease where the pressures inside the lungs are elevated, and it can be caused from a wide variety of various reasons. And one of the subtypes of this disease called PAH, or one of the types, it can be treated with specialized medications to help lower the pressures in the lungs and the arteries that supply blood to them.
So, doctor, let's talk about some other things here. Can you talk to us about unexplained dyspnea? And maybe you can tell our listeners what that is in layman's terms, and also about metabolic stress tests.
Yeah, unexplained dyspnea is a situation where you don't know why somebody is short of breath. And, we have a special stress test we can do here called a metabolic stress test, where we can exercise patients while measuring the amount of oxygen flowing through your body and kind of figuring out when they stopped, why did they stop? Did they stop because of a heart problem or a heart-related problem or lung problem? So, that stress test is called a metabolic stress test that can help us figure out some of these patients that are short of breath for unclear reasons. And, I do have an interest in that part too. We have been actively doing metabolic stress tests in Altman Hospital for the last at least a year or so.
I need to throw this in before time gets away from us. What has happened with heart transplants? Some years ago, this was the next move to we were going to solve everybody's heart problems, and it all seems to be kind of quiet right now.
Well, no, it's stable. The number of heart transplants that we do per year, have been stable for the last many decades. Okay, it's a donor-dependent thing. You got to have donors. And the overall numbers that are happening over the last few years and decades have been pretty constant. They're not dropping, but they're stable. But, I think the heart failure problem in general is a little bit of a bigger problem than the small number of donors that we have. That's where the heart pumps come in, and they're just off the shelf. You don't have somebody else, doesn't have to die for us to get that heart to be able to help somebody else. And it is just off the shelf. So I think that's where I feel like that technology will help us going forward. But the artificial hearts were they messed with those. The guy from South Africa, I can't remember his name, years ago. I think they're not gone. There are artificial hearts that are available. Something called total artificial heart is there, but it is used in a select group of patients in select hospitals. And for the most part, I think the technology with the LVAD or the heart pump, and as it evolves, it may transition into a newer type of device, or maybe a device that can be used on both left and right side separately. So I do feel like these technologies are evolving. All of the work of the pioneers that went into development of artificial hearts has not gone to waste. I think where we stand today is pretty much an attestation to their hard work. And I think, I feel like it's going to continue to improve. It is just, I think, in my opinion, getting better as compared to before.
Okay. What about this? How can healthcare providers remotely monitor patients with heart failure while they're at home?
So, communication is key. Obviously, patients communicating carefully with the providers, letting them know about the symptoms. But in the current era, we also have technologies that can remotely monitor them. For example, if you have a certain type of pacemaker or defibrillator that you have for other reasons, because you have heart failure, you have a heart weakness below a certain point, we put some of these devices in there. But they also have a faculty of measuring fluid level and kind of transmitting that remotely. So we get alerts in some of our patients like that who happen to have these special pacemakers and defibrillators that their water level is rising. And that alerts us, and we call them and say, what's going on? We also have a technology in the pipelines here in Alton we want to hopefully implant in the future called CardioMEMS. CardioMEMS is a small, hairpin-like small device that we can implant in the pulmonary artery, and that can transmit pressures to us. And if the water level or fluid level is rising, we can know that in advance of even the patient feeling the symptoms sometimes. So that can prevent hospitalizations and may help us manage our patient's volume status more carefully. So I think that, those are some of the devices that we have, but good old-fashioned communication from the patient to the doctor and vice versa is extremely important, and monitoring them and preventing them from being admitted in the hospital.
Okay, Doctor, we're running out of time here. Are there any parting words of advice you would like to share with our listeners?
Yeah, I think that, the thing to keep in mind is heart failure sounds like an ominous term, but it is treatable. And I think that, we have in the current era a lot of medications and other options available to help treat it. Majority of heart failure will be, something that, you can live for a while with and do not need advanced therapies like heart transplant or heart pump. But I think crucial would be for us to, primary prevention in the community, improving the way we lead our lives and the way we eat, and, stay away from some of these risk factors that we talked about earlier during the program will be crucial for us to prevent this. This is a pandemic in itself, and it's a huge burden on the healthcare cost and our society. So I think if we can incorporate from a very young age, our children and our people that are going to high school and so on, if we can start making changes in, at that level, incorporate exercises in their routine from a very early age, eating healthier habits, so that our next generation is not suffering from these issues.
Interesting. Do you practice in multiple locations or just a hospital?
I do have clinics where I go to Alliance and Orville. So 2 locations for me. But our practice is, my partners, some of them, they go to multiple other locations like Coshocton, Dover, and so many more. So we have a wide network where we reach out to the community.
Okay. How can our listeners contact you to find out more information about your practice?
So they can contact us directly by calling our office, 330-454-8076. That's our office number. They can directly reach out to us, and they can ask to speak to me or my clinic, the heart failure clinic, or they can reach out directly to any other cardiology provider in our provide that phone number.
Okay. So thank you very much, Dr. Atal Qureshi. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsor, Studio Arts and Glass, and of course, your technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here next Friday on News Talk 1480 WHBC. Thank you very much, Doctor. We learned a lot.
Thank you very much. Thanks for having me.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.